Welcome back to the Deep Dive Ortho. We're the program that digs into the crucial orthopedic insights you need to stay right at the cutting edge of your practice. Today, we're looking at something quite remarkable, actually. The act of throwing. It seems simple, doesn't it? A flick of the wrist, maybe. But whether it's a cricketer's ball or a baseball pitch, the forces, the sheer speed, the coordination, it's immense. Really, quite a feat of human engineering. And understanding the biomechanics isn't just for, performance enhancement. It's absolutely critical for preventing those injuries that can unfortunately derail an athlete's career. So we'll be breaking down the throwing motion phase by phase, from that initial wind-up right through to the follow-through. If you work with overhead athletes, baseball, cricket, javelin, you name it, grasping these mechanics is fundamental. It underpins everything. Assessment, rehab, smart training. And guiding us through this complex topic, we're incredibly fortunate to have Professor Mo Imam with us, whose expertise in orthopedics and biomechanics is second to none. A very warm welcome.
Thank you. It's a real pleasure to be here. It's a topic I find endlessly fascinating. It beautifully shows that synergy between anatomy, physiology, and how the body adapts to these really extraordinary loads. It's a perfect example of orthopedic challenges, and indeed, triumphs.
I couldn't agree more, which is why we're keen to get stuck in today. And for you listening, especially those in medical and allied health fields, our aim in this deep dive is to give you that nuanced, comprehensive understanding. We'll blend the biomechanics with practical clinical applications, and yes, even touch on the psychological side of things, which often plays a bigger role than we think in performance and resilience. So, Professor, ready to unpack this for us?
Absolutely, and it's a great way to frame it, because the first thing to grasp about overhand throwing is that it's a whole-body effort, not just the arm. It's this incredibly rapid sequence, typically all over in about 2 seconds. Start to finish.
2 seconds. That's astonishingly fast.
It is. And that speed, combined with the huge forces, makes it tricky to analyze properly. That's why using a phased model is so helpful, almost essential, really.
Right, breaking it down makes it manageable. I know there are a few different models, 5 phases, sometimes 6. Which one will we focus on?
We'll primarily use a 5-phase model today. Some models do split the cocking phase into early and late, making it 6, but the core concepts are the same. We'll cover the wind-up, then cocking, looking at both early and late parts, then the explosive acceleration, the crucial deceleration, and finally, the follow-through. Each phase has a distinct job to do, generating energy, transferring it, and then safely dissipating it, preparing for the next bit.
Okay, let's start right at the beginning then. Phase 1, the wind-up. What's happening here? Why is this initial bit so important?
The wind-up is, it's the setup, the foundation. It starts with that first movement of the opposite leg. Think of a pitcher lifting their lead leg off the ground. And it finishes when that lead leg hits its highest point, just as the throwing hand comes out of the glove. During this, the athlete rotates their hips and shoulders, usually about 90 degrees to the target. And, importantly, they keep their center of gravity over their back leg. It's not about generating force yet, it's about rhythm, getting the body positioned optimally, gathering potential energy, like coiling a spring, really.
So gathering potential energy, not expending kinetic energy straight away, setting the stage.
Precisely. Muscularly, there's actually very little force on the shoulder itself at this point. The rotator cuff isn't doing much compared to the lower body. It's controlled, almost graceful in a way. If an athlete rushes this, moves forward too early, that disrupts the whole kinetic chain down the line. It means the shoulder has to work much harder later on to compensate. So patience here. Building that stable platform from the ground up is absolutely key.
It really does sound like setting up dominoes. Get the first one wrong, and the whole sequence is compromised, so potential energy gathered. Then we move into the cocking phase. You said this is pivotal with 2 parts, early and late. Let's start with early cocking, the stride.
Yes. The cocking phase overall is critical for storing energy, really loading the system. Early cocking, or the stride, starts as that lead leg reaches its peak height and the ball leaves the glove. It ends the moment the lead foot hits the ground, or the mound. The main point of this stride is to increase the distance the trunk can move, both linearly and angularly.
Okay.
Which means more time and space to generate energy, setting up for the really powerful bit later.
So it's like creating a longer runway for power, a bigger arc.
Exactly that. During the stride, the stance leg, the back leg, its knee and hip extend quite powerfully. This starts the pelvis rotating and tilting forward. Then the upper torso follows, rotating as well. And the speeds here are quite something. The pelvis can reach rotational velocities of 400 to 700 degrees per second.
Wow, that's incredibly fast.
It shows the power coming from the legs and core, And the abdominal oblique muscles are working hard too, eccentrically, to control that rotation and stop the lower back hyperextending. They provide core stability.
And what about the shoulder and arm during this early phase? Are they getting involved yet?
Oh, yes. The deltoid muscle kicks in early to help abduct the shoulder, lift the arm away from the side. Then, towards the end of this early cocking phase, the rotator cuff muscles, supraspinatus, infraspinatus, teres minor, they start to fire up, initiating external rotation of the shoulder. And also, crucially, the muscles around the scapula serratus anterior, the traps, rhomboids, they're working hard to position the shoulder blade, the glenoid, correctly, providing a stable base for the humerus to rotate on.
Given all that buildup, I imagine how that lead foot lands must be absolutely critical for what happens next. What if the landing isn't quite right?
It's hugely important. Landing properly, usually in line with the back foot, pointing towards the target or maybe slightly turned inwards, is vital for efficiency and safety. If the foot lands too closed, so too far across the body, it blocks pelvic rotation. The athlete then has to throw across their body, which reduces force and stresses the shoulder.
Right.
Conversely, landing too open means the pelvis rotates too early, too much. It effectively uncouples the kinetic chain. The arm lags behind.
And that forces the arm to play catch-up.
Exactly. Both scenarios, landing too closed or too open, put extra stress on the shoulder joint. Over time, that's a recipe for potential injury. It's a fine balance.
That makes a lot of sense clinically. So, laid foot down. We're now into late cocking. You called this a high torque phase. Sounds like this is where the serious stress really starts building.
It absolutely is. Late cocking is that period between the lead foot landing and the shoulder reaching its maximum external rotation. This is where you see the shoulder blade retract strongly, the elbow flexes sharply, and the upper arm, the humerus, goes into abduction and extreme external rotation. We're talking 165, even 175 degrees sometimes.
175 degrees of external rotation. That's incredible range.
It is. At the same time, the pelvis hits its maximum rotation and the upper body keeps rotating, tilting forwards and sideways. The lead knee extends, creating that firm front leg brace to push against.
So it's stretching everything to the absolute limit just before release. Which muscles are taking the strain here? What are they doing?
It's a real symphony of muscles working flat out. The front part of the deltoid and the pectoralis major are contributing to horizontal adduction, bringing the arm across the body slightly, getting ready. What's really interesting is that the peak internal rotation torque actually occurs just before the shoulder hits peak external rotation.
Really? Why is that?
It's the muscles preloading, pre-stretching, getting ready for that explosive internal rotation that's about to happen in the acceleration phase. The teres minor and infraspinatus are the key external rotators pulling the arm back into that extreme position. The supraspinatus is mostly providing compression at the joint, keeping the humeral head centered.
Stabilizing the joint under load.
Precisely. And the rotator cuff as a whole is generating huge compressive forces, maybe 550 to 770 newtons.
Can you put that into context? 770 newtons.
Well, it's roughly like balancing a couple of large bowling balls on the shoulder joint during that split second. That force is needed to stop the shoulder joint being pulled apart, essentially, by the forces from the rotating torso. The biceps muscle also peaks here, helping flex the elbow, but also adding to that compression, that stability. And then, the subscapularis, pectoralis major, and latissimus dorsi, the big internal rotators, they contract eccentrically.
Eccentrically, meaning?
Meaning they're lengthening under tension, acting like brakes to stop the external rotation precisely at its peak, stabilizing the joint, ready for the violent forward phase. Oh, and crucially for the elbow, the forearm muscles like FDS and FCU provide dynamic stability, helping protect that medial ulnar collateral ligament from the valgus stress.
It sounds like an incredibly volatile phase for both the shoulder and the elbow. Are there specific injuries strongly linked to late cocking?
Yes, unfortunately. Because of the extreme position and forces, this is the phase most likely to cause internal shoulder impingement. It's also where we see the highest valgus stress on the elbow, that outward force. So the risk of medial ulnar collateral ligament injury, the UCL injury, is greatest here.
The Tommy John injury territory.
Exactly. Things like GRDR, glenohumeral internal rotation deficit, and certain SLAP tears, particularly the peelback type, are often linked directly to the stresses in late cocking. But that extreme external rotation, while risky, is functionally vital. It allows the accelerating forces to act over a longer arc.
Oh, okay.
Which means greater pre-stretch of the muscles and more efficient transfer of elastic energy into the ball during acceleration. It's a biomechanical trade-off, you could say.
A necessary risk for generating power, but one that needs careful management. Which leads us, explosively, to phase 3, Acceleration. This is the moment of release, isn't it?
It is indeed. Acceleration is the really explosive part. Starts from that point of maximum external rotation, ends at the precise moment the ball leaves the hand.
Yeah.
And the speeds are just mind-boggling. The humerus internally rotates at maybe 7,000 to 9,000 degrees per second.
7,000 degrees per second.
Yes. Think about it. The arm goes from 175 degrees external rotation to about 100 degrees internal rotation in, well, about 42 to 58 milliseconds.
Milliseconds. That's almost impossible to picture. What muscles are driving that incredible speed?
It's primarily the big internal rotators. Subscapularis, pectoralis major, and latissimus dorsi. They reach peak activity here, contracting concentrically with incredible force. We're talking forces up to 185% of their maximum measured isometric strength. It's a massive effort. The serratus anterior is also crucial, protracting the scapula, keeping that stable base for the humerus. And the triceps contract strongly to extend the elbow rapidly, over 2,000 degrees per second just before release. That adds a lot to ball velocity. And don't forget the core. The non-throwing side abdominals, the obliques, the back muscles, they're all firing to keep rotating and tilting the trunk, transferring all that energy built up earlier into the arm. The ball finally releases around ear level, helped by a final snap of wrist flexion and forearm pronation.
And how do these incredibly fast movements link directly to performance, to ball velocity?
Several things correlate strongly. A shorter time to reach peak internal rotation speed, for instance, a quicker snap means higher velocity. More forward trunk tilt, typically 32 to 55 degrees at release, allows the acceleration forces to act over a longer path, again boosting velocity. And more knee extension in the lead leg at the moment of release is also linked to throwing faster. It's truly the whole body contributing, every segment perfectly timed.
A full body symphony, as you said. But then that symphony has to stop, very abruptly. Phase 4. Deceleration. This sounds like where the bill comes to, where injuries might happen.
You're absolutely right to highlight that. Deceleration is, unfortunately, often considered the most harmful phase of throwing. It starts the instant the ball is released and continues until the arm finishes its internal rotation and elbow extension, basically until the arm stops accelerating forward. The body's still moving forward, but the arm itself has to slow down from that incredible peak velocity. The humerus rotates back to neutral, shoulder adduction comes down to about 100 degrees, and horizontal adduction increases.
What makes it so damaging? Is it just the sheer force needing to be absorbed?
It's largely about dissipating those enormous forces very, very quickly. It requires massive eccentric contraction, that braking action from pretty much all the shoulder muscles, but especially the posterior ones. Teres minor, infraspinatus, posterior deltoid. They're lengthening while under immense tension, trying to soak up all that kinetic energy.
Like hitting the brakes hard.
Exactly. And the loads on the joint are huge. Posterior shear forces around 400 newtons, inferior shear forces of 300 newtons, and compressive forces over 1,000 newtons, plus significant adduction torques.
1,000 newtons. That's like having a 100-kilogram weight pressing on the joint.
Roughly, yes.
Yeah.
In that split second of deceleration, the biceps and brachialis muscles are also working hard eccentrically to slow the elbow extension down, and the scapular muscles, traps, rhomboids, serratus anterior, are crucial for decelerating the whole shoulder girdle and keeping the scapula stable.
So given those forces, what injuries do we typically see originating from this deceleration phase in the clinic?
Well, the intense eccentric loading makes it prime time for injuries like superior labral tears, SLAP lesions, especially certain types, also biceps tendon problems, brachialis muscle injuries, and strains or tears of the teres minor. This phase is also often the culprit behind posterior capsule problems and the development or worsening of GRD, that loss of internal rotation we mentioned. Essentially, the brakes are being slammed on. If the muscles aren't strong enough or if they're fatigued, the load gets transferred to the passive structures, ligaments, labrum, capsule, and they can fail.
It's incredible athletes can withstand that repeatedly. Which brings us to the final phase, phase 5, follow-through. Is this just about winding down, or does it have its own function?
Follow-through is the final bit, yes, but it's definitely not insignificant. It's vital for the body to rebalance itself, stop the forward momentum safely, and end up in a position ready for the next action, like fielding. The arm continues moving until it stops naturally, with horizontal adduction increasing further, maybe to 60 degrees. But muscle activity generally drops back down towards resting levels. The high force event is over.
So, clinically speaking, is it generally considered a low-risk phase for injury?
Compared to deceleration, yes, definitely. It's essential for dissipating any leftover energy smoothly and maintaining control, preventing injuries from a sudden, jerky stop. But the joint loading itself is relatively low, so it's unlikely to be the primary cause of the major throwing injuries we see. It's more like a controlled landing after a very intense flight.
A crucial safety buffer, then. Okay, we've meticulously gone through each phase. Let's zoom out now and talk properly about the kinetic chain. You've mentioned it throughout. Can you define it clearly and explain why it's so central to performance and injury prevention?
Absolutely. The kinetic chain concept is fundamental. It describes throwing as this sequential transfer of energy and movement, starting from the ground, the legs, and trunk. These generate the initial force, which is then transferred progressively up the body, segment by segment, proximal to distal, culminating in the arm, and finally the ball release. It really drives home that throwing involves the entire body working in sync. It's not just an arm movement in isolation.
So it's truly about how every part contributes in sequence, not just isolated strength.
Precisely. Efficiency comes from synchronous, well-timed activation of specific muscle groups. The legs, quads, hamstrings, hip rotators, and the core provide the stable base and are the main power generators. They start the process, transferring energy up to the shoulder girdle, and the scapula, the shoulder blade, plays a really active, critical role here.
It's not just a passive bone, then.
Not at all. It actively helps transfer energy down the arm and crucially maintains the center of rotation of the glenohumeral joint, keeping the ball centered in the socket. If the scapula isn't functioning correctly, maybe due to muscle weakness or poor control, what we call scapular dyskinesis, it severely hampers that energy transfer. Studies have shown that even a 20% drop in energy coming from the hips and trunk can force the shoulder to increase its rotational velocity by something like 30. Yes, it's a massive increase in demand on the shoulder structures, which of course significantly ramps up the injury risk. Often, the shoulder injury is the symptom, not the root cause. The breakdown is further down the chain.
That's a huge point for clinicians. Look down the chain. Now, when we analyze this clinically, we hear about kinematic and kinetic analysis. Can you differentiate those for us and outline the key variables in each?
Certainly. Kinematic analysis looks at the motion itself, joint angles, segment positions, velocities, without considering the forces causing the motion. It's describing how things move. Key kinematic variables in throwing include shoulder rotation speeds we talked about, that's 7,500 plus degrees per second internal rotation. Elbow extension velocity is another, affecting speed and accuracy, maybe 2,200 degrees per second just before release. Wrist flexion impacts spin and control.
Okay.
We also look at trunk tilt. More forwards generally means more velocity. And knee flexion extension angles, particularly of the lead leg at release. Understanding these helps us refine technique or spot potentially harmful movement patterns using things like video analysis or motion capture.
So kinematics is the how, then kinetics must be the why, the forces involved.
Exactly. Kinetic analysis focuses on the forces and torques generating the motion. Key variables are things like shoulder torque, the rotational force vital for speed, elbow torque, especially that valgus torque peaking and late cocking, and the counteracting varus torque from the forearm muscles. We also measure compressive forces like the rotator cuff, providing that 557 to 70 newtons of compression to stabilize the shoulder in late cocking. Kinetic analysis really shows how the legs, core, and upper body interact to produce and transfer force efficiently.
It's this complex dance of forces and movements, which brings us to muscle activation patterns and coordination. How vital is the exact sequencing and timing of muscle firing?
It's absolutely critical for power, for efficiency, and for safety. There's this intricate relationship between the dynamic stabilizers, the muscles like the rotator cuff, pecs, lats, and the static stabilizers, ligaments, capsule. They have to work together perfectly to allow the range of motion needed, generate the force required, but also maintain joint stability throughout. Muscles like the trapezius, rhomboids, serratus anterior provide that stable but mobile scapular platform. Any breakdown in this timing or coordination, the kinetic chain inefficiency we discussed, makes it harder to throw fast and, crucially, puts much higher demands on the shoulder itself, increasing injury risk. It needs to be a seamless, perfectly timed sequence.
A well-oiled machine, as you said. Crucial for us in practice to understand where that chain might be breaking down. Let's just focus slightly to injury prevention and rehab. Given the stresses, what are the most common throwing injuries you consistently see?
As you'd expect from our discussion, they mainly hit the shoulder and elbow. In the shoulder, impingement, particularly internal impingement, rotator cuff tears or tendinopathy, SLAP lesions, biceps issues, posterior capsule tightness, and GRD at the elbow. Medial ulnar collateral ligament or UCL injuries are very common, especially in pitchers, olecranon stress fractures, and sometimes osteochondritis dissecans. These are the frequent flyers, unfortunately.
And the root causes, are they usually biomechanical flaws, overuse, or something else?
Often it's a combination. Improper mechanics put abnormal stress on tissues. Overuse, simply throwing too much without adequate rest and recovery, leads to fatigue and tissue breakdown. And muscle fatigue itself is a major factor. When muscles get tired, they can't absorb shock or generate force effectively, so more load gets shunted to the passive structures, the ligaments, the labrum, the capsule. They're not designed for that level of repetitive dynamic stress, and eventually they can fail.
So, as clinicians, what proactive steps can we take? What are the cornerstones of prevention?
Prevention needs a multi-pronged approach, grounded in understanding the biomechanics. First, rotator cuff strength and endurance are vital. Not just peak strength, but the ability to resist fatigue. These muscles produce force, stabilize the joint, and critically decelerate the arm. Weakness or fatigue here is a major risk factor. Second, scapular control. We've talked about how crucial it is for stability and energy transfer. Identifying and addressing scapular dyskinesis is key.
Right.
Then there are the fundamentals, proper warm-ups and cool-downs, and thorough biomechanical analysis using video, perhaps to spot flaws. Rushing the wind-up, landing wrong, not enough trunk tilt, too much knee bend, reduced external rotation, scapular issues. Once you identify issues, you need targeted strengthening. Rotator cuff, scapular stabilizers, core, legs. And flexibility and mobility work are crucial for maintaining that necessary range of motion, especially shoulder internal and external rotation and elbow extension. Sometimes taping can offer temporary support or feedback too.
That's a very thorough prevention checklist. But what about athletes already injured, or those just aiming to refine techniques safely? What do effective training and rehab look like?
They need to be integrated. For performance enhancement alongside injury prevention, plyometric training can be very useful explosive drills that mimic throwing demands. But progression must be gradual. Start with low-intensity, short throws, focusing purely on good mechanics, then slowly increase distance and intensity. Strength training needs to be specific to the throwing muscles. Cuff, scapular stabilizers, pecs, lats, triceps, biceps, core, legs. Research clearly shows targeted strengthening improves velocity and reduces injury risk. If someone has internal impingement, for example, rehab isn't just about settling pain. It's about rebuilding robust cuff strengths and scapular control to handle those deceleration forces.
And how do skill-specific drills fit in?
They're essential for translating that strength into the actual throwing motion. Things like long toss, partner drills, they allow practice of mechanics dynamically, building coordination. Again, gradually increasing distance and speed while insisting on good form. Core and leg integration exercises, lunges, squats, deadlifts, build that base power for energy transfer. And technique refinement is an ongoing process, ideally with a good coach, providing feedback to correct alignment, timing, and movement pattern issues. Rehab programs themselves must be highly individualized, addressing the specific injury and ensuring a safe, phased return to throwing. It's holistic performance and prevention together.
That holistic view is so important. Now let's touch on some nuances. We see athletes at all levels, from amateur to pro, and they throw different pitches. How do these factors change the biomechanics? Are pros activating muscles differently to amateurs?
That's a really interesting area, and yes, there are definite differences. Professionals tend to rely more on the big, powerful muscles like subscapularis and latissimus dorsi for acceleration. They generate force more efficiently. Amateurs, in contrast, often show more reliance on the rotator cuff muscles during acceleration, more pectoralis minor activity, and less contribution from the latissimus dorsi.
So professionals are using the bigger engines more effectively. It's not just strength, but efficiency.
Exactly. It's a more efficient and likely more resilient pattern. Amateurs might be overdriving smaller muscles, like the cuff, to compensate for less efficient use of the bigger movers, or perhaps flaws lower down the kinetic chain. This pattern likely contributes to higher injury rates in less experienced throwers. It really highlights why foundational training focusing on whole body power and efficient sequencing is so vital, especially early on. Another difference is biceps activity. Amateurs often show significant biceps action in late cocking and deceleration, maybe trying to compensate for stability or braking. Pros typically show much less biceps activity then, suggesting their primary stabilizers and decelerators are doing the job properly.
Interesting.
Professionals might adapt over time. They might lose a bit of peak external rotation or forward trunk tilt, but they compensate brilliantly by maintaining incredibly high rotational speeds in their pelvis, trunk, shoulder, and elbow. These adaptations allow them to maintain velocity despite small kinematic changes. It shows how the body finds ways to maintain performance.
That's a clever adaptation. But does that long-term adaptation maybe carry its own risks later, or is it genuinely a more robust way to throw?
That's a really pertinent question. It's certainly more efficient for performance in the medium term, but elite throwing always involves immense cumulative stress. These adaptations are often a trade-off. The long-term effects are complex. It might shift the stress slightly, potentially predisposing to different issues down the line, perhaps more related to cumulative microtrauma than acute injury. It really depends on the individual, their training load, recovery. It's why ongoing monitoring remains so important, even at the elite level.
Fascinating trade-offs. What about different pitch types? A fastball versus a curveball, for instance. How fundamentally different are the biomechanics?
While they look similar superficially, each pitch has its own distinct kinematic signature. The fastball is generally thrown with higher pelvic and dorsal rotation speeds, a longer stride, and higher peak shoulder rotation velocities. It's all geared towards maximum speed.
Okay, makes sense. And breaking pitches like slayers or curveballs.
The slider aims to mimic fastball arm speed, but adds that late horizontal break. This is achieved mainly by supinating the forearm late in acceleration, spinning the ball differently, fingers often at 3 and 9 o'clock at release. Interestingly, peak shoulder speeds can be similar to a fastball, hence the deception. The changeup is all about timing disruption. Same arm slot, same basic motion as a fastball, but slower. The ball is held deeper in the palm, fingers stay behind it, generating less velocity but similar backspin direction. Kinematically, you see lower peak rotational speeds in the shoulder, pelvis, and torso. The late knee tends to flex more through acceleration, too.
And the curveball, that classic looping pitch.
The curveball is quite different biomechanically. Slower, different spin. Fingers are more on top of the ball at release to create that forward 12 to 6 foot spin for the vertical drop. Compared to other pitches, curveballs often involve more knee flexion, more forward and sideways trunk tilt, and more shoulder horizontal adduction at release. Shoulder abduction during acceleration might be greater than a fastball. Elbow extension and shoulder internal rotation speeds are higher than a changeup, but generally lower than a fastball.
It's truly incredible. Athletes can make these fine adjustments pitch after pitch. So tiny changes in grip or body position create entirely different kinematic outcomes.
Precisely. Research has found differences in something like 60% of kinematic variables studied across different pitch types. It just shows the body's incredible adaptability and the level of motor control required. Understanding these variations is vital for coaches and clinicians tailoring training for specific pitches, but also understanding the potentially different injury risks associated with each pitch type.
Absolutely. Now, beyond the mechanics, there's that unseen game, the psychology of throwing. How much do mental factors impact mechanics and injury risks?
It's a huge factor and often overlooked. Psychological issues, performance anxiety, fear of re-injury, self-doubt can significantly disrupt throwing mechanics. An anxious athlete might tense up muscles inappropriately, alter their timing, rush the sequence.
Which affects the kinetic chain.
Directly. It disrupts that smooth flow, placing abnormal stress on joints. So yes, mental state doesn't just affect performance outcomes, it can tangibly increase physical injury risk. The mind-body link is very real in biomechanics.
So how can we help athletes manage this? What psychological tools are effective?
Mindfulness is very powerful. Simple techniques like deep breathing or meditation can help manage anxiety and improve focus, especially in high-pressure moments. Mindfulness also boosts interoceptive awareness, the athlete's ability to tune into their body's signals and make subtle adjustments during the throw. Training the mind can actually reduce wasteful muscle tension, leading to more efficient, smoother mechanics.
And routines. Pre-performance routines seem common.
Yes, pre-performance routines are key. They help manage anxiety and signal readiness. They often combine physical warm-ups with mental strategies like visualization, mentally rehearsing perfect throws, and positive self-talk or affirmations. It creates a structured transition into the competitive mindset.
Visualizing success. And during the throw itself, how can they maintain focus under pressure?
Cognitive techniques help. The 3 R's is a good one. Recognize a distraction, regroup your thoughts, refocus on the task. Using specific performance cues, short trigger words like explode or finish, combined with breath control, can keep stress manageable and maintain focus on execution.
Staying present in the moment and after the event. Does reflecting on it matter psychologically?
Post-competition processing is vital for long-term development and resilience. Structured reflection, acknowledging successes, analyzing areas for improvement without harsh judgment, builds confidence and reduces future anxiety. It helps athletes learn from every experience, good or bad, fostering that crucial growth mindset needed for sustained high performance and mental well-being in a demanding sport.
Professor Mo Imam, this has been an absolutely fascinating and incredibly detailed deep dive. We've covered the phases, the kinetic chain, injury prevention, rehab, the nuances of pitch types and levels, and the crucial psychological dimension. It really is a marvel of interconnected
It
systems.
truly is. The forces, the speed, the precision involved in throwing are quite extraordinary. The aim today was really to give our listeners, particularly those in clinical practice, a robust practical framework to better understand, assess, and manage their throwing athletes, ultimately helping them perform at their best while keeping them healthy, both physically and mentally.
And I think you've definitely equipped us with that. This discussion provides so much practical insight to refine clinical approaches and training strategies. And if you, listening, have found this deep dive valuable, perhaps consider rating and sharing the Deep Dive Ortho. It really helps other professionals find these discussions. So, Professor, a final thought perhaps. Considering the incredible forces and precision we've discussed, how might future tech wearables, AI-driven analysis, how might that change the game in terms of performance, but also individualized injury prediction and prevention? Something for us all to think about.